Hi guys, it's Michelle from NGI. In this GeneBite, I'm going to talk to you about the hormone melatonin. So melatonin has been used as a circadian rhythm aid, but many people do not know that it's also a very potent antioxidant, and at higher doses has been used in many disease states to reduce inflammation. It's mostly derived in our pineal gland in the brain, and it follows a circadian rhythm. But our GI tract, skin, retina, and other organs produce melatonin too, not in a circadian rhythm fashion, but actually to protect us from oxidative damage. Melatonin's actions are mediated by receptors, and they regulate reproductive, metabolic, and vasoconstrictive functions, also obviously circadian rhythm, dopamine release, and vasodilation. Low levels of melatonin are seen in many disease states. And in fact, the International Journal of Endocrinology lists low levels in lung, breast, and prostate cancer patients, psychiatric disorders like depression, also in metabolic syndrome, diabetes, and of course, sleep disorders. Low levels lead to a loss of antioxidant and anti-inflammatory effects. So as we age, melatonin tends to decrease. It starts going down around the age of 40 and becomes basically non-existent in those over 80. Supplementation with exogenous melatonin can actually really play a potent role in healthy aging and longevity. People sometimes don't have good reactions to melatonin supplementation. I would have you check your clock gene status. Also, your CYP1A2 status. This is the enzyme that actually metabolizes melatonin from the body. So when you look at these two genes and some other factors, you may be able to change the timing and dosage to actually make it work well for you. Melatonin helps the body know when it's time to fall asleep. So its main mechanism of action is actually to lower your body temperature. But falling asleep doesn't always mean better sleep. But in most studies in people over 55, it does actually help with the quality of sleep when supplementing. Other things that it's been studied for use in are jet lag, seasonal depression, to help lower stress, as an antioxidant. Treatment for migraines has been quite successful. GERD, eye health, tinnitus, telomere length, which may modulate cancer risk, Alzheimer's disease, and it's also a glutamate antagonist, so it dials down inflammation. The negative feedback loop of melatonin supplementation does not seem to exist in most studies, meaning sometimes when we take other hormones, our body may stop making the hormone when you're supplementing. This does not seem to happen with melatonin. Prolonged use also does not seem to reduce its effectiveness, although the longest study I could find was 3 years. Probably need one a little bit longer. So why are we talking about melatonin? COVID-19, of course. As we've discussed in our past GeneBites, the two main mechanisms where the virus enters the body is when the receptor on the ACE2 enzyme detaches due to high angiotensin II levels, and the virus is able to sneak into that opening. But it also can attach to an enzyme called a furin, and furin are enzymes present on almost all of our cells, even ones that have low expression of ACE2, and this is why it's so easily transmissible. These enzymes were seen in COV1, but there seems to be a unique furin cleavage site on that little spike protein that we're seeing in COV2 that was not seen in COV1. And when this happens, the body mounts an inflammatory response. So one part of our innate immune system is called an inflammasome. And the inflammasome we see in COVID-19 is called the NLRP3 inflammasome. And when this is upregulated, we see higher levels of IL-1 beta and IL-18 production. So what does that even mean? When our body is being attacked by a virus, our very sophisticated immune system sends out helpers to increase inflammation and also to reduce inflammation. This delicate balance can go awry though. And when we have too many of the pro-inflammatory mediators, we see bad things occur like acute respiratory distress syndrome because of the initiation of hypoxemia, which is below normal oxygen levels in the blood. So recently it's been demonstrated that supplementation of melatonin reduces inflammation and acute lung injury through inhibiting the actions of this inflammasome. Melatonin has also been studied in sepsis, where melatonin inhibits the NF-kappa B pathway and helps our mitochondria stay happy and reduces reactive oxygen species. The fact that the cytokine storm seen in COVID-19 is induced by this NLRP3 inflammasome really puts melatonin in the spotlight as a powerful molecule, as it can stop this inflammasome activity. This also means that regardless of your age, if you have adequate melatonin, the spread of COVID-19 may be greatly reduced in your body, and the chances of developing ARDS or the lung tissue injury may be diminished. Melatonin might be the reason why children don't seem to have as bad a response to the virus, because they have much higher levels than older people. So for maintenance and keeping your levels normal, 0.3, which is a very low level, 0.3 to about 1 milligram a night can help with that. If symptoms arise and you think you may have the virus, then some studies are indicating that you can take upwards of 5 to 50 milligrams for a short period of time to help inactivate that inflammasome. So I hope that helps you learn a little bit more about melatonin today, and I will see you next time on GeneBites.